I will ask you at this time if you could mute yourselves. We have myself and Miranda and Chip. You're able to chat. If you have questions, you're also able to raise your hand in the participation feature. So again, if you could mute yourselves at this time, and if you have questions, you can use the raise your hand feature as well as the chat feature. If you have questions for us specifically as we're going through and having this conversation together. There are also reactions, so you can clap or you can thumbs up if you also want to participate in that way. We are at 10:03. So again, I welcome everybody to our follow-up town hall. I want to give a special thanks to our reopening to Reimagining task force. Most folks are on this call, and so we're thankful for them. Part of that group will talk today are Bradley Kibler, who is associate pastor at Shallowford and has her master's in public health. And so we're thankful for her. And Hamilton Barnes, who is a chaplain and is on the front lines, as you would say, of what's happening as it relates to this coronavirus. So I'm going to open us with a word of prayer. Let us pray. Gracious and loving God, we give you thanks for this day. We give you thanks for our churches that are represented. Lord, you are calling us into uncharted territory, and we're doing it decently and in order. We're doing it with wisdom and strength. We thank you for the reopening to Reimagine Task Force. And God, we ask that you just be with us in this time so we can talk together about best practices and ways to serve your people and to serve your kingdom. We thank you for this and every opportunity to gather. Through Christ our Lord we pray. Amen. For our time this morning, we're gonna hear from Hamilton, who will talk a little bit, and Bradley, who will talk a little bit, and then I will talk a little bit. I did ask for questions via email. I didn't receive any at all, which is fine, but will also leave space open for questions, best practices, and also just ways that we as a staff can support you. We're just thankful for the ways in which you all are doing unbelievable things in this pandemic. And so we just want to walk alongside you and support you in that way. So I am going to turn this portion of the meeting over to Hamilton.
Hello, everyone. My name is Hamilton Barnes, chaplain at Piedmont Atlanta Hospital. Worked here a little less than 10 years. I work primarily in the ICUs, on college units, and several of our COVID units. Have been doing that since the beginning of the pandemic. Just kind of a little brief overview about kind of how the hospital's been going. Numbers were really high. We had opened, the Congress Center. We'd opened a new wing at Piedmont months ahead of time, and then the numbers got a little bit better in June. And they have spiked back up higher than the initial like heightened of the pandemic, what they would call the initial surge. And our numbers are even higher now than they were before. Just last week, we had the governor open up a special unit at Piedmont, Atlanta. He also opened the Georgia Congress Center. And then we also have Northeast Georgia Hospital in Gainesville built a mobile hospital out of shipping containers. And little hospitals, around the city have turned their 14-bed ICUs into, 40-bed ICUs by using extra beds on other units and people putting, extra building rooms, and et cetera, et cetera. And so that's kind of the state of where it is right now. There's still a lot of patients. There's still a lot of really sick people. We know a lot more about the virus. There's a lot of drugs we know that work. But at the same time, there seems to be really healthy people that are not doing well and kind of sick people that are getting better. And so we're still working with that. One thing we do want to highlight is the website COVID exit strategy that we highlighted for y'all last time, which kind of just gathers data and kind of puts it in like a, you know, green means go, yellow means stop, yellow means slow down, red means stop. They had to add a fourth category, dark red, for uncontrollable spread, meaning that there's no way to contract trace. There's no way to kind of open up safely at all. And so now I wanted to highlight that there's this dark red on the map, and the map is mostly dark red. Just last week, most of the South was dark red. Now most of the country is dark red. Just wanted to highlight that for you. Besides the hospitals being very, very full, we also know it's taking a long time for testing to come back, which can add challenges as well. I know personally, we've had people that their test has taken 14 days to come back, and we know that some people, the virus isn't even contagious for 14 days. So that's not really a helpful information at that point, except to know that you had it. But we also know that you can have it with a negative test. So there is some false negatives in that. So we just have to be careful, and we just want you to know that it is very much still an issue for our communities, all our communities, whether we're in the city or in more suburban or rural. And also some other information to be aware of is that the CDC is now recommending hospital staff to wear not only the mask, but also eye protection in every patient's room. We were only wearing the eye protection in the COVID positive rooms. But because of the uncontrollable spread in the state of Georgia, we're now wearing those safety goggles or face shields in every patient interaction. And that's to protect the staff. That's some new information we have as well.
Thank you. Bradley just posted the COVID exit strategy in your chat feature. It's just something that's really helpful to look around to make sense of that. Even Hamilton bringing up the fact that they had to add another color, I think just says a lot about where we are with things. Thank you, Hamilton. Bradley.
Awesome. Thank you, Aisha, and thank you, Hamilton. Again, I'm Bradley, and I serve as associate pastor at Shallowford Presbyterian Church, and I'm grateful to be a part of this task force and be with you this morning. So I'm going to share my screen with you all, and it will be no surprise based on Hamilton's report that our recommendations, unfortunately, from May 12th are still intact. So we are still recommending that our churches go by the skating criteria, which means most of us are not even in phase 1 still. All of us really are not necessarily in phase 1. So I'm going to copy this link and paste it into the chat once I finish my presentation so that you have it to refer to. But really, as a presbytery, we are encouraging you to remain closed for large group gatherings and to think really carefully and start building task forces if you don't have them, or conversations around what it looks like to reopen. If you haven't begun as well, so I'm going to scroll down to the bottom of this email to start gathering this PPE equipment, this personal protective equipment for your congregation. This is something you want to start doing now so that you can be agile, and the moment that we are able to reopen, you have these systems already in place. I think what's really important to remember here is everyone's situation is different. We emphasize this a lot in our first gathering together, and it's going to be contextual. It's going to be particular to your site and your size and your resources in terms of space. So that's something we really want to emphasize together. I don't know how many of you have seen this "Reopening is About Who God Is" article from Presbyterian Outlook, but I thought it was just helpful to look at and share with some members in our congregation. And one line particularly stood out to me. I'll also paste this link so you can see it. And it was, "Our decisions about reopening should not be about what people want, but what they need." That is our role. What do people need in this season? And it's really hard with the anger and grief many of us are experiencing from our members to sort of succumb to the what they want. And it might also be what we want, but what is the health and safety of what is the best for the health and safety of our members? The other item I wanted to share with you guys as we're beginning to plan for coming back together, and Aisha will talk, some of our churches have begun to gather in different ways, is sort of preparing for when someone gets COVID in your congregation. With an uncontrollable spread, the likelihood is high that as we begin to reopen our doors, someone will get it. Maybe they don't get it necessarily from our site, but they bring it on to our site, and then there's obviously the potential to spread. So I wanted to just take a minute, because there's things we can do even as we're not physically together to begin to think about strategies for managing that. So here we go. So can you see prevention and response strategies for COVID-19 outbreaks? Aisha, I'm looking at your head. Can you see that?
Oh, I can see it. Yeah.
Okay, perfect. So this is just sort of a little infographic to help us think about the before and after of this scenario. So the before side is a lot of what you've already seen in the previous infographic about sanitizing spaces, only using spaces where you can actually physically distance, using cloth face coverings, taking temperatures. But this section at the bottom, I'm focusing on the before side right here at contact tracing. Things you can do right now are begin to establish a way to manage attendance. So this might be a check-in, a sign-in person, to go ahead and update your emergency operations plan to include COVID-19 protocols. This has been with us for half a year and likely will roll into another half a year. And so at this point, it is important to build it into your system. Go ahead and begin planning for when a staff or congregant gets sick and what that's going to look like. And some of the after section we'll go over will have something to do with that. And then in this greater good section, know your numbers. It is so helpful to members to know that you know what you're talking about, and the Department of Public Health or the COVID exit strategy are excellent resources for that. And the last thing listed on the before side is go ahead and identify the contact information for your local health department so that if there is an outbreak at your site, you don't have to spend time figuring that out and you've already communicated with someone there about what that looks like. So moving to the after side of this graphic makes a lot of sense. If someone comes in with COVID, we need to clean and disinfect all areas. And we really need to spend some time reassessing the use of our facilities. So we talked in our initial meeting about going in and out of these different phases or stages. And this is bingo right where it hits. If someone in your congregation gets sick, we really need to think twice about, have we expanded too much? Do we need to completely shut down? Do we just need to go to smaller groups? Or do we need to tighten the reins on what we're already doing? Which leads into sort of reassessing what our protocols are for keeping people safe. Behavior, we're gonna have to provide a lot of pastoral care if there is a COVID outbreak on our site. Some of you may have experienced that already with members just in their homes. There's a lot of grief and fear that comes with that. So as pastors, we wanna do that. And then moving down to the contact tracing section, we wanna communicate with all of the participants who were exposed on site and potentially exposed while still maintaining that confidentiality. So it is not appropriate for us to say, Aisha has COVID, and so everyone, you've been exposed by Aisha. That's unhelpful, but it is important to say one of our members has been diagnosed with COVID, and so you have been potentially exposed, and then encourage testing and quarantine. As pastors, that is not something that we are able to manage, but it is something that we can promote and encourage and affirm. And so we want to do that in a positive light. So that section right there is really important in terms of being sure you have an attendance system that allows you to quickly react when someone, so if you just have the names and you're going to have to gather all the phone numbers or all the emails, they're potentially out in the world exposing other people unknowing, where you want to be able to respond pretty immediately once you know there is a case. Moving down to the greater good section, you want to inform your whole congregation. So there's the initial step of the people that were on site and potentially exposed. And then the next step is informing the entire congregation that there was an exposure and being ready to say what your updated facility use policy is. So that goes back up to the top when we're reassessing use of our facility. We want to go ahead and say, these are the immediate changes that we are making. And then it's part of the greater good. We want to be able to report the initial case and potential outbreak to our local public health department, which is another great reason to go ahead and figure out who that is in your area. We span quite a broad part of Atlanta. So in just this call, we might touch several different health departments. So go ahead and figure that out. And just recognize that their role is to contact trace. So they will be wanting to know who was in attendance, and you already have those records, and that is to prevent further exposure. So that's really important for us to manage together, and it's for the greater good, and I think that's part of our faithful calling. The last little link here I have at the bottom I included because much of what I've included in this infographic comes from the CDC website, and so I'm going to share, I'll paste all of this in the chat, but I wanted to share that page with you as well so you could see. So this is the considerations for communities of faith based on the CDC. And some of you may have already read through this. I'm sure many of you have. And it goes into more detail on what the infographic is. It is not a very long document. I don't know about some of you, but some of the information that's been poured out is so lengthy, it's just hard to even get through. This isn't, and it's pretty specific. Some of this stuff you'll be able to go right through because you've already started the process. The part that I wanted to point out specifically is at the bottom right here, where it talks about a closing, and it's very helpful in terms of finding your local health department. So if you click here on local, it will go to this other website that will help you identify your local health department. So if you click on Georgia, and then you can scroll down and see exactly what the phone number is. And I encourage you to go ahead and call and have a conversation with whoever your health department person is, just so that you can be sure they might have even more advice to give you about a case outbreak. So I just, again, encourage you to remember that this is a grief process. It's also an innovative process, and it's about caring for all the sheep in the flock. And this is not meant to be discouraging, but really truly meant to give you tools so that when you are able to go back, to come back together as a community, you feel equipped and empowered, and also you aren't feeling like you're the only one in this. Certainly, as a presbytery, as I mentioned at the beginning, our recommendations are still to stick with that initial letter that we sent out, and to put the needs and the safety and health of our members and the life above sort of what their wants are, which is tough, but thank you.
Bradley, thank you so much. We are so blessed to have just the members of this team thinking together and using their gifts to support this presbytery. If you're taking notes or feel like you're not catching everything or what link was that, do not worry. First, this conversation that we're having together is being recorded and will be uploaded as a YouTube link that you can utilize and you can share. Mark, Miranda, and myself will be working together for another constant contact link, which will have information and infographics so you can get that all together. And also on our website, there's a big button that says COVID-19, and you click on that, and all the things that we've been uploading and sharing are easily accessible. But as it relates to this conversation, there will be more communication going out for that so that you can have that. And again, for those of you who need to grab stuff really quick, Bradley has put everything in that chat feature, which you can grab, and you can even save the chat feature to your desktop as well. Thank you so much. I just wanted to give you guys a little update of what we are observing as a staff and what we're seeing among the congregations. Since March 15th, you all have done an amazing job turning on the dime and going to virtual worship in ways that I want you to know are recognized across the country. Like people are noticing what you all are doing from a distance. And it's an affirmation and it's an encouragement to other churches across the country when you stream, when you pre-record, when you do things distanced or outside. Like it's really a ministry in and of itself. So since March 15, we have been keeping track of who was going to all online services. We have also been keeping a track internally of who slowly participated in person, who's doing things in some creative ways. So I just wanted to give you kind of an overview of a snapshot of that. We have about 84 churches, 26 new worshiping communities. Pretty much all of our new worshiping communities remain with online worship because they're new, they're younger, they're techie, they're able to do that. And the ones that are nested in other congregations, because those spaces are closed, they've just continued to reach out in virtual and digital ways. Right now, we probably have about, of our 84 PJ congregations, we probably have about 14 that have some version of in-person and or, also stream worship. That means that the rest of y'all are really doing things virtually. And I just want to affirm how well you all are doing this. I cannot say that enough. Like, it is really incredible. I probably go to 2 and 3 worship services a Sunday. I'm popping over here, I'm popping over, I jump in the chat, way to go team. I love it. And so it's just, you guys are really doing that well. But I wanted to give you some, again, some snapshots. As you know, it is the session's decision to mandate masks and distancing and requests for no congregational singing, sanitation stations, communion. That is session responsibility. So again, big affirmation to sessions and leadership who have had to make these difficult decisions, who have had to say you're going to do one thing, and because of the numbers, have had to scale back. So just know that we see you, we understand, we're praying for you, we're walking alongside. We were joking around about what is the Book of Order reference to affirm sessions responsibility over worship, and Donna assured me that W-5.0205. So you can go in there and say, this is our role, right? And keeping people safe is part of sessions responsibility, to care for the flock, to care for the congregation, to care for the community as well. So here are some snapshots of some things that people are doing and being creative as they're making a sense of how to manage going back in person in limited ways. We talked to James at First LaGrange. He talked about having to do a special 50 people distanced funeral for someone who was very, very, it was a very intense funeral in the community. It hit the community really hard, but they also told people distanced, masked, people abided by that. So that's an example. Destiny, I hope I'm not speaking out of turn, but McDonough, we talked about the outdoor worship, correct? You can unmute and give you a little screen time. There you go.
Yeah. So what we are doing, we have this great outside pavilion, which is right outside our sanctuary. And so we have blocked it off into 6 feet squares. And so each family that wants to come can sit in a square. Our 8:30 service is, that's when we are doing it currently, just because it's a little cooler at that time. And then we have the option for people, we have big circles drawn out so families can sit on the outside of the pavilion if they want in the shade. And so it's a brief, it's a more condensed worship service that we are doing then. So it goes until about between 9 and 9:15. So it's just a way for them to kind of see each other at a distance. They have to wear face masks. They have to stay 6 feet apart. So yeah, so it's just a different way of doing it. And then our 11 o'clock is continued to be live streamed.
Excellent. There is a wonderful video done by Korean Central. They did a demonstration of what people were to expect for limited and in-person worship. You could tell from the presentation, and it matched what happened on Sunday, that people drove in, they parked every other space, they came in and were distanced. You picked up your bulletin, you picked up, you could put your offering in the sort of offering kiosk, if you will. And then all of the markers for the distance seating were labeled. There was limited folks up front. Bradley also has a Korean Central video in the chat. And then Sunday morning when they were live, I almost thought I was looking at the video because people adhered, masked, everything that had been exemplified in this is what you are to expect in worship actually happened when they had limited, distanced, masked, sanitation station, in-person worship. So again, part of that too is as you are doing these things or thinking about it, not only do you have everything in place, all the stuff that Bradley was talking about, but communication to your congregants, communication to your visitors about what is to be expected and what will be upheld if someone comes into the space. Not to put any pressure, but I think Amantha is here. Oakhurst has been doing once a month outdoor worship on Communion Sunday. Amantha, if you wanted to unmute and say a little bit about that.
We are doing it's at 9:30 because of course the heat, and the congregation receives the bulletin for the service online, no paper passing. What happens one way in, one way out. They come in the back parking lot and there are two people at entry that have on masks and gloves, and they have a tray. We have the prepackaged communion. It broke my heart to order the first set, but it's for safety. So they have the cup and the wafer there in one place, and you only touch what you will use in your car. So the families are encouraged to get what they need there. And then they come in and park. We've had a platform built in the parking lot, and the service is through we have a local FM radio signal, so they can listen in their cars to the service. And when they leave, we have communion together. Nobody gets out of their car. And then on the way out, there's one way out, and there's a person there with a basket, mask, and gloves that will accept your offering. We have two members of the finance committee that then collect that basket with masks and gloves and count the offering, and we lock it up for 3 days and don't touch it. And that's what we do at 9:30, and it's an abbreviated service, of course, because of the heat. It's about 40 minutes max, and it's gone very well. We had more people this past Sunday than we've had, and this was our third Sunday during the service. So it has gone very well. Thank you, Aisha.
Thank you so much. And you all are doing such a great job communicating and checking in. I know Johns Creek had started off with what they called a tie-through kind of drive-through, and people brought their tithes and offerings, and they received prayer in a drive-through kind of way, which has been great. I think they are also utilizing FM transmitters so that people can tune in their cars. So there's that technology as well. I believe, Joy, forgive me, is it Bullhorn is one of those apps? Am I saying that correctly?
Bullhorn FM, we learned about from Betsy Turner at Stockbridge, and it's basically a podcast that you can access on your telephone. So she records her announcements or service, and members who don't have a computer or are not willing to get on Zoom or Facebook or not computer savvy can just call this phone number and listen to the whole service. So
that's awesome. So that's Bullhorn FM. Thank you. So as you can see, people are being really, really creative. And for some of our churches who never, had to go online, offline because they were small, because they had enough space, have also, remained distant and have been careful as well. I do want to lift up some of the conversations with other mid-council leaders, just to let you know that even with all the best intentions, with all of the best precautions, you still could have a scenario where someone contracts COVID-19. One of my mid-council colleagues did a detailed account of one of the churches in his presbytery, and they did everything right. They were distanced, they had everything in place, and at least 2 or 3 people came down with coronavirus. And they were stunned. And so they had to pull back. Even their limited, precise, decent, and in order, everything meticulous, we still run a risk. And so I think we want people to know that there are just still risks involved, and to affirm the ways in which you all have been doing hybrid and just, virtually online worship have been absolutely incredible, life-giving, and amazing. Other things, that there are a few churches who've made the decision not to meet in person, or not to meet in person for the rest of 2020. Our offices as a presbytery will be closed through the rest of 2020, and we will continue to minister, support, and be a presence virtually in all the ways that we've been called to do that. And part of that is also an example to say you all are doing amazing work in this unprecedented season, and however we can model and support to say that you can be virtual and vital. Even watching you all do mission with masks on, watching you feed people, again, McDonough doing drive-by dinners where people in the community can grab, something to eat and be safe, watching people who have needs that can come by and get the resources that are happening. People are still doing that in safe ways. So I think you all are just doing incredible work. Just the reality is we may be at this for at least another 6 months, if not to a year from this point. And so we just have to be as honest and real as we can be. Other things to consider, if people make decisions about, virtual in-person worship for the rest of the year, be really clear about your decision making. Some folks are saying that people can have small gatherings up to 10 folks out on the lawn in certain spaces. Some of our children's ministry programs at Morningside, they're doing popsicle pop-ups. I don't know if Emma's on the call, but I was so tickled with that, to just drive by somebody's house. I told her I live right here in Decatur, so if she want to pop by with a popsicle, that's fine with me, and a little bit of prayer. But there's just all this creativity that is happening as well. I do want to tell you to look out. We will have more information, but we are the recipient, as a presbytery, we're the recipients of a Presbyterian Disaster Assistant Grant. We received $25,000 for what we are calling virtual and vital grants. So those will be small grants up to $1,000 to help with technology support for the things you all are doing. You may need a better subscription for Zoom to be at webinar status for a year. There may be that camera, or there may be that, Mark's not, I don't know if Mark's on this call, but Mark will be able to say all the techie things way better than me. But the things that Mark suggests, you may need assistance in that. And that's just, it's a gift from our denomination, but it's also a way that what we do are encouragements to folks to say, you are really doing an amazing job in virtual space. We're being asked a question. If there are congregations that don't have as many resources, we will provide as many masks as we can. Thank you. Thank you. So I want to open it up. That's sort of our, kind of where we are, or just what we wanted to encourage you or bring you up to speed. But I just wanted to open the floor for comments or questions or ways that we can support you as a staff and as a Reopening to Reimagining task force.
Yeah, I have a question.
Sure.
This is Dave Omerod from Greenville. I noticed in the Presbytery minutes that the Presbytery received a $191,000 grant through the, is it the paycheck program? Now, do you have somebody in Presbytery that one of my people can contact to find out how to do that?
I will open the floor to Chip on that one.
I would be happy to talk with someone about it. I to be honest, haven't looked to see if there are funds still available, but I would certainly be happy to have a conversation with someone.
Thank you.
You're welcome. Yes, Fred. You can just unmute yourself.
I have a question, or I have a comment, and then I have a question about a situation that we have at First Pres in Peachtree City. Is everyone aware, I'm guessing everyone is aware of the law, the liability limitation law that's supposed to go into effect on August 7th? Because that is basically, it has, they're waiting for the governor's signature, but it goes into effect if he doesn't sign it or veto it. Basically, but what it encourages is putting a sign up on your building, and there's specific language in that law that that says what you put up there. But basically, it says that people, you're immune from liability unless you do something intentional, reckless, that causes someone to get COVID-19. So that I share that with everyone, because if you're going to open up for anything, particularly if that law goes into effect, it would be a good idea to put that sign up on your entry points to your building. The second part is we have a kind of a unique situation. Many of the other churches may have this. We have two schools in our church. One is a preschool and kindergarten that has been part of our ministry and mission since the early 70s. The other one is a 2-day-a-week homeschool, private school, where the kids come in and are for a couple of days a week to socialize and have in-person classes. Both of those entities right now are planning to open. The private school, they will open next week on the 11th of August. And our preschool is now waiting to see if they're going to open on the 17th. We've had meetings with them all. We've shared protocols. We've shared, guidance that you all have provided to us. We've looked at the plans that they have for reopening. So I just wonder if anyone else has had any experience with that, or has any thoughts about special things to do, because we're talking about a combination of not only church mission and ministry, but we're talking about education and guidance from the CDC and health department about education, which right now in Fayette County, for example, gives you choices. You can do total brick and mortar, you can do virtual, you can do a combination of that. So anyway, long-winded question or comment.
And I have two participants raising their hand. I will just say, Fred, what we've observed is that people are differentiating from school decisions and worship decisions, that there's still precautions that preschools and schools can do that actually seem to be a little bit different than even the behaviors of adults in in-person worship.
And that's exactly the approach we've taken, Aisha, is working with the educators and the healthcare professionals to make sure, and we are comfortable because that this is not a small group like a circle or something else that might meet in our building, which we have different approaches to. We haven't opened up for them.
Right.
Yeah, so thank you.
I think they're difficult decisions, but at the same time, I think that, again, differentiating and to say what is the best scenario, because there are give and takes for people being at home with their kids all day versus the emotional, social aspect of all of these things.
Right.
And they're difficult decisions to make. I have Tony Sundermeyer, Richard Allen Farmer, and Russ. So I'll go in that order: Tony, Richard, and then Russ. Oh, is that right? Am I looking at that right? Maybe it's just
yeah.
Richard.
I had my hand. I just put it down, Aisha. Thank you.
You can go.
And I don't think you said it exactly the way that I was going to say it. Was just the differentiation between the schools and the church ministries. Our school is it's part of First Pres. It's not a separate 501c3. but we realized, and it's the oldest continuous preschool in the state of Georgia. And if we did not open, there would be no school. I mean, I don't mean that like there would be no class, there would be no school. And so some of that was driven, you know, by the brand, the economics, and to let parents choose. We're going to create as safe as environment as we possibly can. There's inherent risk. Of course, we can't mitigate all the risk, but we felt like that was the most prudent decision given all the factors. Our enrollment is down significantly. I think in Metro Atlanta, we're seeing that at all the preschools, the ones that we are interacting with that we know of, they're all on course to open in person. And we're following just in a blanket way, the CDC guidelines on reopening for schools. So every protocol we basically copied it verbatim and put it in our policies. And investing in technology, like for carpool, we're using an app where parents, and it's geofencing. So once they get on campus, it pings the teacher's phone. They're going to come out. No parents are going to be allowed in the classrooms or in the building, at all. And so those guidelines, I think, are pretty helpful. But again, we cannot eliminate the risks in total, but we felt like we had to move forward on that. And I think Aisha's comment is succinct and spot on. I think you have to treat ministries differently, even within your own context.
Can you say, thank you, Tony. Can you say the name of the app that GeoPings again, please?
I knew you were going to ask me. I have no idea. Our preschool director has told us about it. I'll text her and see if I can come up with it real quick.
Okay, you can.
I'll put it into, yeah.
To me and Miranda, that'd be great. Thank you. Richard Allen Farmer, please.
Yeah, we serve as the landlord for a small Christian school that is in our building. I think there are 14 students. We do not charge them rent. We just started gifting the space to them 2 years ago. We did ask them to be responsible completely for seeing to it that the space that they use, maybe 4 rooms at the back of our building, is sanitized, and they're responsible for putting up the dividers for their students. And we did ask them to confine all their activities to that end of the building. They used to, for instance, have chapel each morning in our worship space and then go to the back of the building for their classroom time. And we asked them to please confine themselves for all their activities, with very few exceptions, to the part of the building they already occupy. So they'll have their chapel back there, but they've put in their own plexiglass dividers. They're doing their own distancing, sanitizing that end of the building. Since we are not collecting rent, we thought it fair to say to them, okay, you're on your own in terms of being responsible for obeying the protocols that are out there and available. But we did ask them not to traipse through the building as they normally would. So we thought that was a fair arrangement between landlord and school that uses our building.
Richard, thank you for that so much. Amantha said, and Russ, you are next after these 2 comments. Amantha said that Oakhurst has a preschool and they can't come into any area that's not part of the preschool, to echo what Richard Allen said. That 2 staff members have to wear a mask. They submit their COVID plan before they could reopen, and they have to sanitize the kitchen. And also they hold harmless, am I saying that right? That hold harmless form, right? Which is, Fred, which is basically what you're saying too, that the building is hold harmless, like you can't hold us responsible, and then people know when they come in as well. Katie Owen Almond brought up an article that said, it's as opposed to using safe language, which is fine, encouraging people to say reducing the risk, because that reminds people that there is a risk. Katie, thank you for that language. And if you have a link to that article, that would be awesome. It's just really helpful. So we're keeping you safe and reducing the risk, but I think that that's helpful language. Russ Weekly, please.
So Fred, one of the things here at Good Shepherd that we're doing is we're also, it's not just about keeping the parents out of the preschool space, but keeping the membership out. We're fortunate enough in the campus here that we have the Christian Education building, but then we also have the Fellowship Hall sanctuary space. So any and all other ministries than the preschool are being pushed into other spaces. We've had a little bit of trouble with some of the members saying, hey, it's my church, I can go where I want. And to that end, we've said, okay, we're going to take away your key card access. No, you can't. But that's one additional step that we've taken.
Russ, thank you for saying that. And again, it's hard to have to say some of the hard things, but definitely telling people, listen, you can't have your key card, what have you. Russ, did you have another? Thank you. Other comments or questions? You have to, it's a lot of you on here, so you'll have to unmute yourself or use that raise the hand feature. Or other ways we can be helpful for you as a staff. Oh, Cheryl, I was just going to call on you. Is that your hand up, Cheryl? I was just going to call on you to say something. Go for it.
You just call on me because I'll always talk. Fred, do you know where I could find the language for that sign? I was just trying to find that on the internet.
Yeah, Cheryl, I will send it. Chip, I will send you a copy of the bill, okay, the Senate bill and the language that's in there. Matter of fact, I will send you a copy of the sign that we have created.
That's
okay,
helpful.
I'll send that to Chip and then you can share it. And again, I recommend everybody double check and make sure this gets enacted into law. You don't want to put signs up and find out that that's not the law, but I believe it's going to be the law as of the 7th. But I'll send that to you after we finish this.
It'd be helpful even if it doesn't become law.
Yeah,
so,
yeah.
Being the camp person in the room, everybody has seen the news articles and TV shows about High Harbor. And some people say they followed all the protocols. They did not follow all the protocols. They did not require the children to wear masks, even when they were up close. They were doing singing. They were doing the yelling callback things.
Right.
And they were sleeping and staying in rooms with no open windows and no ventilation. And so I've been researching, and Bradley, I'd love to understand your opinions about this, that ventilation is going to be very important in these preschool classrooms and all that. Calvin Center is considering becoming a digital learning pod area, and we'll have the tables 10 foot apart from each other, one kid per table, blah, 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 and have high ceilings. But the ventilation from your moisture from your mouth doesn't necessarily go up. They're saying that you ought to have a window with a fan blowing the air out, as long as the weather is conducive to that. So Bradley, I'd love to hear your opinion on that.
Yeah, I would say that the ventilation research up to this point is a little bit all over the place. I think there is plenty of evidence to suggest that being outside is the lowest risk area to be. And then once you get in if you're in a larger room, there's a little bit more risk if you're a smaller room. So I think at that point, it's sort of just coming down to risk management. If you can be outside, that's the first choice. If you can be in a bigger room, that's the next choice. If you can be in a small room but have the windows open, that's sort of helping to navigate a little bit of that risk. But there's not really a perfect answer there. If there's 15 kids in a room talking to one another, it's a difficult scenario, even with all the added additions. It looks like Hamilton wants to add as well.
Yeah, I was just going to say, like, we're even learning in the hospital setting about things we did in the very beginning, as far as like adding extra filters into rooms. We're not doing as much anymore. What you're describing is called a negative pressure situation, and like Grady's tuberculosis unit, where they're housing most of their COVID patients. It blows all the air from that unit at like a massive speed out of that room. Like all the TB patients that are in a hospital, those rooms blow the air out of a closed, filtered, ventilated system. I mean, essentially what you're talking about is a small version of that. And I don't know how effective a window unit in a room the size of y'all's dining hall would be. But the real thing is you can't take your mask off. And you need to keep their distance, and everyone needs to be washing your hands all the time. I can't socially distance in my work in the hospital, but I don't take my mask off unless I'm sitting in my own office. I think that's the key thing is, even if you're 6 feet apart, even if there's plexiglass, these kids have to wear their mask.
Well, and that's like in our big dining room, we would only have 20 children, and they'd be spread totally apart, 10 on one end, 10 on the other, with big areas. But yeah, we'd still do the temperature checks and all that stuff coming in, and hand washing constantly. And I think the way we were successful in camp, going back to what Bradley said, is the children were only inside for about an hour during the whole day. They came at 8:30 in the morning and they left at 5. They were inside for lunch, for going to the bathroom, and for changing into their bathing suits. And that's it. Other than that, we were outside. But when this lasts into the winter, we're not going to be able to do that as much.
Mhm.
I have a question. Yesterday, Dr. Fauci said, this is Dave Omerod from Greenville. Dr. Fauci said he would not be around any group bigger than 10 people. And we've already heard about churches that have done everything right, and they still have people getting sick. And you don't know if your parents are sending a child to preschool where somebody at the house is sick, but they just want to get the kids out of the house. And then my doctors have also stopped using the forehead thermometer because they said it's not very accurate, and they were getting people with fevers anyhow. How would you address the fact that even when they do everything right, people are getting sick? And is that a risk you want to take?
I think, as you have said, each context will have to discern what level of risk do we want to take depending on what we have going on. And that's session conversations. That's the Lord is the Lord of the conscience. I mean, we're just raising what we already know to be true. But thank you for that. I want to go back because I have a comment in this conversation about children. The question that I just received was about actual daycare, where there are infants up to preschool. Most of our churches are more preschool. And so I have not come across what people's experiences are with a daycare that's open, say, 10 hours a day. So if there's any comment or experience with what daycare centers are doing, that's a question on the floor.
Aisha, my kids started back at daycare yesterday.
Okay.
And the CDC criteria and the county health department criteria is the same for preschools and daycares. So the same sets of PPE, the same temperature checks, the same small class sizes and social distance and masking. And there's not a separate criteria for daycares as opposed to childcare center or as opposed to preschools. And at that point, then it's just up to a particular parent and the criteria and practices that your school's put in place to decide if that's the right decision for your family. But if you're trying to decide as a church what to do with a daycare center, there's not a difference in the CDC published criteria for one versus another.
Thank you, Katie. Chip?
Aisha, we are at First Pres Atlanta. We're opening our Parents Morning Out, which is not a certified daycare, but we do 6 weeks old rather to just under 2 years. And we're, as Katie said, same guidelines, and they're all available through the CDC website.
The one caveat to that I would add is that the CDC is clear that children under 2 don't have the lung development to wear masks. So like my son who's 20 months is in a class without masks. My daughter who's 3.5 is wearing a mask all day. And they're doing surprisingly well. Like all the kids just, they've got their mask style and peer pressure works. And so, you know, yeah.
And a child shall lead them. Our kids are doing a good job. That's awesome. Chip?
Yes, someone in this gathering sent me the bill that Fred was talking about, and I think I posted it in the chat. Are people able to see that attachment? Okay, good. Just wanted to make sure.
And again, Miranda and I will pull this together and get your notes from this. Are there any other comments or questions for us, or ways we can support?
I have a parting comment that's not related before people leave. If you're a commissioner or a pastor, please register for the Presbytery meeting. We are doing registration in a new way, and so all the pastors were sent links to be able to forward to their commissioners. And if you're a visitor, you are welcome. There's a way for you to register as a visitor. Thank you.
Thank you, Donna. Well, I want to, I think I will bring this meeting to a close. We are here to support. We are praying. We are walking alongside. If you're doing something different or you're doing something creative, even if you don't need our help, please let us know what you're doing, because your ability to navigate through these difficult times is actually encouragement and testimony to your siblings across this presbytery and nationally as well. We're a big group and we're really diverse. And so people are looking to say, hey, what are they doing down in Atlanta and the surrounding area? And how can we be encouraged? Because these times can be quite discouraging. But I think you are all doing a fantastic and amazing job. When I tell you that we love you all and are praying for you, I really, really mean it, because we really, really do. You guys are making decisions that are extremely difficult. But I think that, you know, with God's help, we will get through these things. So I would like to ask Destiny if she would offer a closing prayer for us.
Sure. All right, let us pray. God, we thank you for this day. We thank you for the technology for us all to meet and discuss the future for our churches, the future for our schools. We thank you for each and every one that was on this call and those that could not make it, as they work and plan and keep the safety of our pastors and our members, and to keep them safe. And as Bradley said, what is best and what are the needs of our church. Be with us this day and keep us all safe. In your name we pray. Amen.
Thank you, everybody, for being here. Have a great rest of the week. Thank you so much. Miranda and Donna, can you all stay on this call, please? Thank you.
Thank you.
Thank you. Take care.